Hello, and welcome to our webinar on medical training rotations. This is a first for me in HEE, and so bear with us if we get some of the IT wrong. But I'm hoping that by joining tonight, you will be a bit better informed at the end of the webinar as to the work that we've been doing on medical training rotations and what that means for you. So tonight on the webinar, you have me, Shona McLeod. I'm the Interim Medical Director at Health Education England, and I'll be joined by Professor Adrian Book and Professor Simon Gregory, who are Deputy Medical Directors in HEE. Now, the first thing I think I wanted to cover was the fact that COVID has had a profound effect on us as individuals, on society and on medical training. I think when we started, we hadn't quite appreciated how great an effect that would be. And I'm sure for a lot of you who've been working, especially in some of the more pressured frontline areas, it will be an experience that you will look back on and reflect on for years, and that will have a significant number of negative experiences or experiences you can learn from, as well as a number of positive ones. And we've been aware of this, that it is a difficult time for trainees because of what's happening with COVID. And what we are now trying to do is give you clarity about the training processes so that it is clear that we are thinking about your future. So tonight we're focusing on rotations, and we appreciate that normally trainees like to know rotations as early as possible. August is a time when most people rotate and enter foundation and core. And higher specialty training is when people start on them over the summer. Some of them is outside the August window. So what we've done this year is looked at a number of different options. Should trainees rotate? Should they not? At what time? In what specialties? And what areas? Trying to bear in mind the fact that there will be differences in different parts of the country and different pressures. And the plans currently are that all core trainees and foundation trainees will rotate as planned in August, and that there will be some leeway across the higher specialty programs. So some of them may rotate outside the usual August timeline, depending on what works best in the local area that you're likely to rotate into. This flexibility in a local area will help us ensure that trainees have high quality training posts to go into that meet their training needs. It also starts to introduce a degree of resilience in the system. And one of the positive things from the pandemic has to be how we learn and improve things for you for the future. So I'm going to pass over now to Adrian Brooke, who'll start to answer some of the questions that you've put in, and Adrian will then pass over to Simon. So Adrian, if I can move over to you to start to answer some of the specific questions that we've had in before now.
Yes, thank you, Shona. We put out a request for questions. There are 4 questions I think I'll deal with first before handing on to Simon. And they cover similar themes, but I think they are worth highlighting. So one question that's come up is that trusts are proposing limiting trainee access to surgery, and there's a concern that there'll be a real wish for trusts to ensure that everything is consultant delivered, and there's a worry that that will lead to delayed training and therefore to bottlenecks. And there's a very legitimate question about how we'll plan to try and address these issues. and how we work with trust to ensure that people do get safe training and avoid sort of having to necessarily lengthen training programs. So we know that as the pandemic starts to subside and more normal practice starts up, that there will be this impact on the restart of waiting lists, and particularly for this question concerning surgery, surgical activity. Now we're going to recommend this, and you'll hear this a lot in the next few responses, that as trainees, it's really important to have an early meeting with your educational supervisor or with your training program director to outline what issues that you've missed during the COVID pandemic, what opportunities you've missed, and therefore what additional areas you'd be looking to try and make up over the next period of training. Because there'll be an upsurge in activity, we hope there will be lots of opportunities, both to observe and to pick up skills and capabilities that you may have missed out on previously. But part of that gathering up of those capabilities really is that early discussion and planning, trying to move forward about what capabilities you will try and gain. So the next question I have was someone who's missed a rotation, and it was an area they were really interested in pursuing as a specialty, and they want to know if that could be accommodated to allow them to do that in the rotation. So once again, as we return to a more normal pattern of practice, an early meeting with your educational supervisor or your training program director is really important to review the experience that you've missed and try and explore the opportunities that you can gain going forward to pick up those lost opportunities. Now, whilst you might not be able to go and repeat a past rotation that you missed out on because of the pandemic, there may be an opportunity to gain some of these capabilities on a more sessional basis. So that may be, for example, attending outpatient sessions or theatre sessions or clinical sessions, whilst you're attached to another part of the rotation. So you can't replace it completely, but you can pick up those other capabilities. There are no hard and fast rules here. So discussion with your supervisor is really, really key. And the timeline here, I think, is worthy of note, of mention, because this is not something we're going to ask you to make up in a couple of weeks or a couple of months. We know the effect of the pandemic is going to be quite long lasting. So there will be some time to allow you to make these capabilities up. The next question was about the opportunities that there might be within training programs to swap rotas to rebalance training after the impact of the pandemic. And this is a tricky one, because as we start this more normal mode of training and service provision, it's important to remember that as junior doctors in training programs, we learn by in our attachments. We also learn as part of delivering service, including service on out of hours rotas. I think it is really important that we're aware that in some parts of the country, the pandemic may show an uptick, and there may be particular stresses on your particular rotation, in your particular specialty, in your specific area. So it's therefore not possible to give you blanket assurance that you can swap out of a rota to make up capabilities. But again, your training program directors will be looking at flexibilities that can be shown locally wherever that's possible. And again, that discussion, that key discussion with your educational supervisor and training program director will really help you work out where those flexibilities can be accommodated. The fourth and final question that we got ahead of time is what will happen to registrars who are dual accrediting or needing specific placements that have spent an excessive amount of time in one area during the pandemic and therefore lost time in another. Now we know that because of the pandemic, some of you have spent a lot of time, a lot more than you would have planned or bargained for, in a specific area of clinical practice. and that may not be the area that you had been programmed to do. So again, a discussion with your program director and your educational supervisor about areas that you may have missed out on, and then try and work with them to acquire those opportunities elsewhere along your rotation. Again, time is not critical here. It doesn't have to be done in the next few days, weeks, or even over the next month or so. There is some time. We know this will carry on for a while. Remember, we've got ARCPs happening this summer, and ARCPs will continue. They will be next year, and that gives you a timeline to consider how you will acquire and make up any of these capabilities. But it gives you a longer timeline and longer to actually program and review how you're progressing against getting these opportunities. And with that, I think I'll hand on to Simon for the other questions that we got ahead of schedule.
So a few questions, and as well as being the Deputy Medical Director for Primary Care, I also have responsibility for well-being, and these questions really fit with that. So the first question that some of you asked was, when will out-of-programme experiences resume? Oops. And when they do, will it be the same for all regions in England? Now, as far as we're concerned, out-of-programme is a really good opportunity. Whether that be for training, research, other educational opportunities, or indeed the new pause, it's all good to give you that flexibility, and we're keen to continue that. Out of programme has always been at your Dean's discretion for them to review your request and for them to permit you out of programme. There was a temporary callback, as you would all appreciate, and I know because you're working on the front line, or indeed some shielding and would have been affected as well, that we needed a temporary callback because we had to get ready for whatever the scale of COVID might be. But the good news is that we are able to restart, and that will be done on a case-by-case basis and on a deanery-by-deanery basis at your Dean's discretion. As you will appreciate, Deans, along with their heads of school and training programme directors, need to balance the needs of those that want to go out of programme with the trainees that are left behind, that still need to have time for their own education, and also to balance it with ensuring integrity of service to the public. So it's likely to vary depending on the level of virus in your community and in the provider that you're working in, and pressure on that service. But at your Dean's discretion, it can be resumed. So our suggestion would be that if you are wanting to do this as a new application, or you're wanting to go back to your out of programme, you have a discussion with your training programme director on behalf of your Dean and find out what the situation is, both locally and for you personally. And I hope that helps. So then there was a question on doctors that are shielded or needing to work from home. And of course, that also includes pregnant trainees. And I will cover the rotation element of that, but also remind you that on the HEE COVID website, we've got specific guidance on these points. So doctors who are shielded and working from home, you're really important to us. We need to look after you and your training. Rotations in August and those starting in August may be particularly affected. And what we will do is there's a survey coming out to you all in a few days' time to make sure that we understand, because there are different levels of shielding. There is true shielding of the individual. There may be other factors such as your risk factors that don't meet a shielding letter from your GP, but actually are still an issue that you need to be protected. We will treat each of you on a case-by-case basis. There is already some guidance in place. So, for example, we have many GP trainees that are now working remotely, as they can do digital consultations or telephone consultations. And I've also been talking to some secondary care trainees who are doing outpatient connects remotely. Now, of course, it varies according to specialty how feasible that is, but we do have guidance in place. And again, our TPDs and our deanery teams would be happy to try and help you with that, because we do recognise that each person has very different needs, both in terms of your health and the health of your family, if that's the reason for your shielding, and that each person's needs are different educationally as well. The important thing is that we need to look after both support in your health, but also your education, and we need to consider both. So then there was a third question, which was, when will trainees across England have access to equitable travel and relocation expenses? And that included a question over what happens if you've got to move across the UK in August, recognising that it's challenging to find housing with both shift working and also the current restrictions on moving around the country, and possibly even things like house viewings or arranging removals. So yes, we are working with colleagues around the country. We recognise it's an issue. As lockdown is lifted, we realise there will be problems with relocating, and we're trying to find reasonable ways of supporting that. It is perfectly reasonable to ask your employer, your current employer, for time to find accommodation. You can't be expected to move with nowhere to move to. The other issue that's come up around expenses and travel and such like is that people have been asking what happens to their annual leave, for example, if they have had to cancel leave during the response to COVID. Can they carry it forward to another job? At the moment, we don't actually know, but we're trying to find out. We're working with NHS employers, and they have posed the question along with us in the Department of Health to the Treasury, and we're waiting for their decision. But we would expect to get back to you as soon as we know. And I think at that point it's time for me to hand back to Shona.
Thank you. So we have a few questions that have come in. One of them is, will there be any scope for removing the March 2020 deadline for swapping individual FY2 rotations? Now, that will make a lot of sense to one or two trainees and not to others, because this is a regional decision and a regional process. And if this is a local arrangement, the best thing that you can do is contact your local foundation school, because we have slightly different arrangements around the country. And as much as possible, we are looking at where we can have flexibility to allow for individual circumstances, but finding out from your foundation school what their deadline is and whether there's any flexibility, you're best to cover with the local foundation school, because this isn't a national issue. Now we have a second question, which is about the situation for run-through training programs, like obstetrics and gynecology, where there's already regional differences in the start of rotations. For ST1, are we now saying that they will rotate differently because of COVID, or will it be as pre-COVID? And the answer to that is it will depend on the region. That's where the flexibility is, that if they can start at the expected time, that will happen, but we're accepting that there may be differences in different regions. We're hoping to let trainees know as early as possible where they will be going, so they can check on what is happening in their region. Now, we also have an interesting question, which is that you mentioned there's flexibility for trainees who don't rotate in August, to see if they could potentially rotate earlier and get some extra posts in a rotation, as long as the TPD agreed, which we haven't got any process at the minute to allow people to have extra training rotations. But there is a question later on that relates to what happens when you miss training rotations. And nationally, there are areas where trainees were deployed elsewhere, or where rotations changed, where there may be slight changes arranged with the postgraduate dean. And I think whoever asked the question on surgical trainees rotating can have a go speaking to his training or her training program director and see if the postgraduate dean has any flexibility. But there is no plans for moving trainees earlier so that we can try and get people into training posts earlier. There's a recognition that this has been a difficult time, and that people perhaps need a break if it's possible to get one. So we are not trying to push people into training any earlier than they would be. So there isn't any plans for rotations happening, but if you have a good idea, I'm sure your training program director and postgraduate dean will be interested in hearing it. Now, there's a question about foundation year doctors not being disadvantaged by not having completed a medical rotation that I'm going to ask Adrian to answer. I think the linked one is what will happen if you've been deployed and not done part of your training that you expected in a core medical post. So, Adrian, do you want to answer that one?
I can certainly have a go, Shona. Yeah. So, yes. I mean, we do know that Foundation as a program is deliberately a very broad program and gives you really, really broad experiences. So you're very, very unlucky if you've not had any medical experience, given the timing of the pandemic in relation to the broader foundation program over the 1 or 2 years that you've been in it. So we would think that would be really quite unlikely, if one's brutally honest.
Thanks, Adrian. And if it applies to you feel that you've missed an essential post because of COVID, because your rotation didn't happen, all of the medical colleges have looked at the person specs for recruitment to ensure that people are not disadvantaged by not having had placements, and that COVID doesn't have a detrimental effect on trainees' chances at recruitment because of placements that they weren't able to experience. Next question is academic. Will academic foundation programs or clinical fellow rotations be affected in the near future? I think the question is maybe how are they being affected at the minute, or what are the plans? Because academic training has been significantly affected. A large number of trainees who were focusing on balancing academic and clinical work had to come back and focus purely on clinical work. So everyone involved has been taking part in discussions to see how we can minimize the adverse effects on people's academic training. And discussions are ongoing about how academic training will restart for those people who have moved out of their academic posts and concentrated on clinical work, and how we will introduce academic placements in the near future. One of the issues is that you need to have supervisors and labs working to be able to do your academic post. And what I think is positive if you're interested in academic training is that all of the system is keen to work together to maximise your opportunities and to provide flexibility. We have a question about extra training time, which I'm not going to cover now. With missed exams, we will have another webinar where we look at recruitment. And I will note down questions like that, which we won't ignore, but we'll come back to and cover at another time. So trainees who have been deployed to other specialties and wish to access supported return to training. Simon, are you able to cover that one?
So I don't know the specifics of what Sarah has put there, although reading it, it looks like Sarah knows what she's talking about. What we will do is take that to the Medical Education Reform Programme team and that are running the support and double check it and make sure that that is addressed in the follow-up to the questions on the webinar. There would certainly be a desire from all of our postgraduate schools to support a return to training. So, for example, in general practice, the primary care deans have put together a recovery programme specifically aimed really at the doctors in ST3 that now need to get their final MRCGP assessments. So we're targeting support, whether it be through that funding or through the schools. It's in all of our interests to help you get the best out of your training, both reflecting on what competencies you may actually have gained by the changes that you've stepped up to, and how we can use those and how you can use them, but also how we help you fill any deficiencies in your training and opportunities. I think it also links, if I may, Shona, into the question that's come about people that have been rotated and then can't go back, or their trusts seem not to be willing to let them go back. And again, this is why we have the school and deanery support structure that we have. And it's really important that if you've got a concern, you feed that back through your educational supervisor, or if you're not getting anywhere with that because maybe your educational supervisor themselves is not available, either that they're shielding or they're unfortunately unwell or whatever, then others in your school, like the training program directors or the head of school, ultimately they're there to serve the dean or on behalf of the dean. You'll notice the Gold Guide says the dean or their designated deputy. We want to help, we'll do our best. Each case though, I can't say everybody can move tomorrow because as we read in the press at the weekend, Western Hospital is rather busy at the moment. It will become very much a local and case-by-case basis, but it's in HEE's interest to get you back into training because that's what we're here for. We want to support your training and get you through so that you can have fulfilling careers, and we'll carry on trying to do that. Back to you, Shona.
Thank you, Simon. So looking down my Slido, I think we've covered the questions that people have put forward. It would be helpful to know if this kind of interactive presentation is useful. So feedback, positive or negative, is welcome. As I said at the beginning, we will have another one of these where we look at covering other issues, and one of them will be the ARCP outcomes, the missed exams that came up in this. I think Simon summed up beautifully what we are trying to do at the minute, which is get you the best training and the best support so that your careers progress and you have a positive view of the future and come out of what has been a very difficult time for all of us in the NHS, and especially trainees trying to train and work in the front line, and that you come out of that feeling positive about the future and what you've done and will continue to do for the NHS. So thank you very much for joining us, and we look forward to any of your feedback. Thank you.